Chapter 30, Personality Disorders. The social realm and individuals are part of being human. People are gregarious, meaning they're sociable and need the company of others. Some individuals can live in isolation, but most need interaction with other people. Personality may be defined as the composite of behavioral traits and attitudes that identify us as individuals. To find satisfaction, people establish relationships. Some relationships have a special degree of closeness and sharing that becomes important in life. These relationships often develop into intimacy as another person becomes significant. One's personality is established early in childhood and is molded throughout their experience. Personality is a set of attitudes, traits, and behavior patterns that express emotional, intellectual, social, and spiritual aspects of an individual. Developing intimate relationships requires a willingness to reveal the private side of one's individual self. That would be the emotions, beliefs, attitudes, dreams, and anxieties that describe one's individual nature. Infants are not able to see themselves as separate beings until they're about the age of 18 months. The toddler's personality is still changeable and undefined, but as children grow and age, the personality will take shape. Between 18 months to 3 years, the toddler learns to separate themselves from the caregiver and explore the world that's around them. Toddlers will seek parents and caregivers for support, encouragement, and approval. In the early school years, children learn about cooperation, competition, and compromise. Peer relationships assume more importance, and approval is sought from individuals outside of the family. Without support and encouragement, the needs for guidance and approval for the child go unmet, and this helps set the stage for later problems in their life. Teenagers are categorized by their peer group. As adolescents grow, their relationships expand to include members of the opposite gender. Sexual issues can produce anxiety as teenagers struggle to assume a sexual identity. Sexual activity for these young individuals is experimental and spontaneous. Most individuals are self-sufficient, make decisions, and are involved in a give-and-take style of relationship. Occupational choices are made. Families may be started during the adulthood years. Self-awareness grows as individuals learn to balance personal independence and meet needs of others. In middle adulthood, many individuals are comfortable enough with themselves and their personalities to encourage independence in others. It is believed that once personality is established, it remains stable and constant. Yet, adulthood offers opportunities to look inside oneself and decide what aspects of the personality they wish to keep and develop and what they want to change. People are dynamic in physical and psychological motion. Change occurs constantly, even one's well-established personality. It is important to remember that older adults' sudden change in personality is not a normal sign of aging. By older adulthood, the personality is deeply enriched in the individual. They have their own pattern of thinking and behaving that remain intact until death. One's temperament is genetically based. Temperament is a biological basis that underlie the moods, energy level, and attitudes of an individual. The brain mechanism that connects emotions and intellect may be missing or inefficient, in individuals that have personality disorders. Sigmund Freud divided the personality into three components. The id, which is the source of all innate biological needs. The id seeks immediate pleasure and gratification. The ego. The ego actually mediates between the id and the superego and resolves the conflicts between the two. The superego embodies restraints imposed upon by societal rules and moral values. This is sharp contrast to the id. The interactions of the id, ego, and superego can result in abnormal behaviors. The behaviorist approach to psychology is behavior that is learned, and the focus should be on observable behavior. From this point of view comes two different types of learning: classical conditioning and operant conditioning. These are based on praise. With separation, the individual theory believes that the average 1 to 2 year old are to achieve object consistency. Gender and culture will play roles in abnormal behavior. Women are likely to suffer from depression more often than men. Schizophrenia often occurs in lower socioeconomic classes. The lack of social structure, which is normlessness, and societal roles are risk factors for the development of personality disorders. The most important criteria for diagnosing a personality disorder are the individual behaviors that are inflexible, long-standing, maladaptive, and result in significant functional impairment. Rigid, ineffective behavior patterns will often occur throughout a broad range of occupational, social, and personal situations. The onset of maladaptive patterns can be traced back to childhood or adolescence, and there are no medical or other mental problem that can account for the maladaptive behaviors. The profile of an individual that has dual diagnosis can include one or more of the following. They have severe or mental illness and substance disorder. They would have a substance disorder and a personality disorder. They would have a substance disorder, personality disorder, and substance-induced acute symptoms that require psychiatric care. Or the individual can have substance abuse, mental illness, and organic syndromes in varied combinations. Organic syndromes may be the result of substance abuse or can be independent of substance abuse. Refer to Table 30.1 in your textbook for classifying 10 personality disorders and describing their most significant associated behaviors. At one time in our lives, each of us have shown some sign or symptom of the following disorders. Paranoia or paranoid. This is when one is distrustful and suspicious. They see other individuals' motives as threatening. They may interact in odd or distinct ways. Schizoid. This is a detachment from social relationships. The individual is often cold and distant and absorbed in their own thoughts and feelings. Schizotypal. This is an acute discomfort with close relationships, sensory distortions, odd behaviors, thinking, dressing, and speech. And these experiences will have produced extreme anxiety for these individuals in social situations. An individual with an antisocial personality disorder is often referred to as a psychopath or sociopath. The hallmark of a psychopath is a lack of conscience. The serial killer Ted Bundy could probably have been diagnosed as having an antisocial personality disorder. He used his good looks, charm, and intelligence to get close to his victims. The victims were sexually abused and murdered. He lacked anxiety and guilt, and this compelled him to continue. An antisocial personality disorder disregards or violates the rights of others. These individuals ignore rules of acceptable behavior. They are impulsive, irresponsive, and aggressive. Borderline personality disorders, the individual has an unstable self-image, emotions, moods, and behaviors. They are very unpredictable and self-destructive. Histrionic personality disorder, these individuals have excessive emotional expressions and attention-seeking behaviors. A narcissistic personality disorder, these individuals have an exaggerated sense of self-importance. They have grandiose thoughts. They have no empathy or concern for other individuals or animals, and they require constant attention and admiration. Avoidant disorder is social distress, feelings of inadequacy. These individuals are oversensitive and unwilling to become involved with others. The dependent disorder, this is where the individual needs excessive care. This results in a clinging, submissive behavior. They want others to make decisions for them. Obsessive compulsive disorder is a preoccupation with control, orderliness, and perfection. These individuals are never satisfied with their achievements. They are methodical, orderly, and inflexible, and they have a difficult time adapting to change. For therapeutic interventions, first, all physical causes are ruled out. An in-depth history, including recent injuries, are gathered. Psychological tests and physical examinations are performed. The diagnostic tests that are commonly ordered are a complete blood count, thyroid function test, screening for HIV and other sexually transmitted illnesses, a CT scan, and an X-ray. The treatment decision for personality disorders is guided by the symptom, the complaint, the problem, and the willingness to cooperate. The treatment for personality disorders is complex because these individuals have extreme diverse treatment needs, and there's no single treatment that's appropriate for every individual. Many individuals that have personality disorders do not seek treatment or refuse to accept it because of their history of conflict. They have a basic mistrust of others, and often they lack extreme amount of insight. Medications are used with caution in the treatment of a personality disorder. There are no medications specifically approved by the FDA to treat personality disorder. Often anti-anxiety and antidepressants are prescribed to help relieve the depression and anger associated with these disorders. Mood stabilizers will help with impulsivity, irritability, and aggression. Antipsychotic medications are only indicated when an individual is losing touch with reality. Most psychotherapeutic medications are prescribed in limited amounts for short periods of time because their effectiveness in treating personality disorders is still being examined. Anti-anxiety medications would be Ativan, Valium, or Buspar. These will help reduce tension and stress. Antidepressants would be Elavil or Prozac. These will help increase feelings of well-being by acting on neurochemicals. These will take 2 to 4 weeks before improvement is seen. Anticonvulsants, Dilantin, phenobarbital, Tegretol. These are CNS depressant medications that prevent seizures and control moods and impulses. Antipsychotics like Halidol and Thorazine act on brain and central nervous system to control psychotic symptoms and behaviors. Lithium helps control the exaggerated thoughts and behaviors associated with mania. Short-term goals are based on each individual's assessed problem. Many individuals use manipulation, charm, or other subtle behaviors to achieve their purpose. They often use a technique called splitting. This is when they emotionally divide staff by complimenting one group and then degrading the other. The staff need consistent limit setting and reinforcement to help define the limits. However, the caregivers must keep in mind their own therapeutic boundaries and communication whenever they are frequently with another individual.